Hello, hi everybody, welcome back to another video. Today we're gonna do a very quick video on the difference between a psychiatrist and a psychologist, because I know this is an area that a lot of people find relatively confusing and some people think it's the same profession, when in reality, they are very different from your day-to-day tasks that you do, and also very different as to what is required to actually become a psychiatrist or psychologist. And now stick around to the end of this video because I will have an infographic that will help you distinguish rather quickly. Begin by looking at the requirements to become a psychologist. First, you're going to have to complete your PhD in clinical psychology. And now this is usually a 4 to 6 year program, and you will have to complete your master's before or within that 6 years. And so it definitely is a lot of schooling, and you will be a doctor by the end, but not a medical professional, which we will come to in a bit here. And now within that PhD program, there's going to be a very strong focus on research. And now that would be researching anything within the clinical field, whether that be researching specific disorders or researching treatment plans for disorders or anything really within clinical practice. However, they are preparing you to be in academia. And so that is why there is so much focus on research. However, you will be learning a lot about clinical practice as well and getting some training in that area. And contrastly, a psychiatrist is in need of a medical degree, so an MD. So they have to go to medical school, and following medical school they will then have to specialize in psychiatry, which is usually an extra 5 years of education post medical school. And now within medical school, they're in the exact same stream as everybody else. And so you will be learning about pharmaceuticals, which will come into play later. And you will be learning about, the medical ethics and learning about all the other medical specialties while you are in medical school. And now the requirements are not the only difference between the two. The job description or the day-to-day tasks also differ quite radically, I would say. A psychologist will specialize in the assessment, diagnosis, and treatment of every, mental disorder that you could have that is in the DSM-5 criteria. And key thing here is they are able to diagnose. They're one of the only mental health professionals other than psychiatrists who are able to do that. However, they cannot prescribe medication, and they're also not covered by OHIP, which is the Ontario Health Insurance Plan. So clients are paying out of pocket and usually are paying around $180 to $200 per 50-minute session to see a psychologist. Aside from practicing clinical psychology, a psychologist can also be within a university doing research or teaching. They can also be working as a consultant for pretty much anywhere. And so there's more of a variety, I would say, with a clinical psychologist position. And now shifting back to a psychiatrist, they're going to specialize in the medical treatment of psychiatric patients. And so they're taking more of a biological approach to mental health while looking at, brain imbalances and what else could be going on physiologically in the body. Maybe it's a hormone imbalance or a wide range of things that I personally do not understand because I am not there in my education yet. And because they're taking a biological approach and that they have went to medical school, they are able to prescribe medication. And now medical doctors in Ontario are the only people who can prescribe medication. So this is one of the major differences. Secondly, psychiatrist appointments are covered by OHIP, meaning that the public, the individual, the client is not paying for their services, which sounds lovely. However, there often is a very long wait time to see a psychiatrist. And now both of these professions are mental health professionals. They both conduct psychotherapy. You're going to get the same level of help from these two individuals. They are very much both doctors. However, one is a doctor of philosophy, which is a Ph.D., and one is a medical doctor, which is an M.D. So I hope that cleared up some things for you. I hope you are walking away from this video with a better understanding of the two professions and what makes them similar and what makes them different. And here is that infographic that I promised. It is also posted on my Instagram if you want to save it for a later date. And my Instagram handle is methodically Maya with no space in between. I will obviously have it linked below, as well as linked to my channel if you want to check that out. Thank you for watching this video. I hope you enjoyed it. If you're not already subscribed, click that subscribe button, and I'm happy to join you to our small but growing group here at Methodically Maya. It would make me very happy if you left a comment, if you gave this video a like. It definitely helps me along the way, so thank you in advance. Stay safe and stay happy, and I will see you again on Monday.